When you talk about blood clots, there are several forms of blood clot. One is in the arterial system. Arterial system clots or plaques or rupture of plaques can cause stroke, can cause heart attack, can cause peripheral vascular disease where circulation to the leg is affected. So that's when people get amputation or wound that does not heal. So when we are talking about blood clots in general, it's a very layman term. We don't use clots in that respect. When we are talking about heart attack, it's a clot, but it's in the arterial system. So think about it this way. If I were to vasodilate the arteries to the heart, I make the vessels of the arteries relaxed, the chances of you having a heart attack is much less. What causes heart attack? It is pressure, stress, shear force, cholesterol, hypertension. What does hypertension do? Increases the stress of the arteries. So therefore, stress of the arteries are more prone to getting a heart attack. Now, if I were to give a compound or a medication or a nutritional supplement that relaxes the vessel, then the stress is taken away. So the incidence of heart attack goes down. If I were to have poor circulation to the leg because there are atherosclerotic plaquing, if I were to vasodilate, then blood flow gets to where it needs to go. So think about it this way in layman terms. If on the fall, tree loses all its leaves. That is how every organ in our body's blood supply is. It's like branches, big trunk followed by smaller branches into twigs. That is how our arterial system is, whether it's to the eye, to the brain, to the leg, to the heart. Now think about a person who has diabetes, hypertension, high cholesterol. It is like somebody taking a shear, pruned the tree. So the small twigs are no longer there. So the blood supply is affected. Now if I were to give a compound like Arginext or Argilife, all of a sudden the Christmas tree lights up again. We have reopened all the small vessels. That is how it works.